Hello, doctor. How are you feeling being on our show today?
Thank you very much. I'm feeling very nice. How are you?
I'm good, Alhamdulillah. Okay, doctor, how is Oman treating you?
Oman's a very nice place. This is my second time, my experience. Especially when I came first time in the airport, the people were very warm. And we stayed there for 3 or 4 days. I don't know exactly, but it was very nice. Traditional meal, food was very nice. It was similar to
Similar
Turkish culture.
to Turkish
Yes, I
culture.
like it. But of course, there are differences, people or other culture. The sea was very nice, ocean very nice,
Yeah, the
very
nature
hot.
is very beautiful here.
Yes, the seaside was very nice. I liked it, very nice.
True. Okay, doctor, what is the medical field of Oman like compared to the Turkey field?
Yes. I saw that it's very similar. It's very similar. The hospital and all the technology is very high, and also the diagnostic instruments are very good, and to the especially treatment procedure to the patient was very nice. I like it, and it has a good technology from worldwide. I see from United States, from Germany. I see it, but I like it, and it will very develop more.
Doctor, as we know, you're treating sleep apnea, which is one of the the sleep disorders that we are unaware of. The society is unaware of. Like many people in today's generation, I think majority of the people have problems sleeping. Sleep disorder is very common everywhere around the world, but they are not aware of this sleep apnea disease, and they think it's normal. It's normal to not get a proper sleep in the night. What are your takes on this?
First of all, this is a real big problem. First of all, World Health Organization declared that 10 times greater is the number of the population suffered from the sleep apnea. And this apnea problem is not only in for example, poor countries, not only in, for example, in Africa, or not only in some region, in all worldwide. You can get good education. You can have good industrial products. You can get good income. It doesn't also
It doesn't affect all these factors.
Yeah. Therefore, we know that sleep apnea is a really, really big problem, and it especially happens when you are over 30 years old, or sometimes 20 years old, because the risk factors is also you can face with these risk factors very easily. For example, these factors are when you are smoking, when you are overweight, when you are, for example, using drugs, when you have some immune system problems, then you can also have sleep apnea. Therefore, in future, I think we must also focus to solve this problem. Otherwise, we can have also more attention problem, more diabetes problem, more anxiety problems.
True, because again, if you don't get proper sleep, the
Yes,
whole day
of
goes
course,
bad,
of
and
course.
it affects your lifestyle. It affects the way you're working and functioning in life.
Certainly.
But doctor, as we see, people only know about insomnia and they don't go to the root cause of it. But when it comes to sleep apnea, I think even majority doctors don't know about it.
Yes.
Right? Why is it happening? Because as we see, its major reason is snoring.
Yes.
And snoring, we all take it very lightly, like, because majority of the people don't accept that they're snoring.
Unfortunately.
And if they do, then they're like, okay, it's a normal thing. If I'm tired from the whole day and I'm snoring at night, it's normal. So they don't go to the doctors and say, you're snoring or there's some issues. And I've seen that even the doctors are unaware of this concept, the sleep apnea concept, they're unaware of.
Yes.
So when should a person go to the doctor and get themselves checked? What is the issue? When is that point when okay, I have some issue and I have to go to the doctor now?
Yes. This is a very, very, very important question, and if we answer this question, we can solve most of the problem. First of all, I must say, if we are traveling too much by plane, especially by plane, if we are, for example, going from United Nations, it takes 10 hours, 11 hours. When you, or for example, drink too much, for example, alcohol, because alcohol also must mainly affect the relax of the muscles, yes. Then you will snore. Maybe this snoring will also occur during traveling, during journey, and then if it's slow.
This is normal snoring.
That is normal, so you can't say anything. But if you snore all the time, It is important.
Mm.
There are a lot of criteria. For example,
Mm.
when you wake up and when you wake up very tired, wake up means you must be fresh. You must fresh mind. You must have fresh water, fresh air. But most of the people wake up very tired.
Even after sleeping.
Yes, even after sleeping.
That is because of the problem.
Yes, this is also a problem. For example, when you wake up and you will be nervous, this is another factor. Especially in some families, most of the, for example, when the husband get up when he get up, most of the families suffer from him. They don't want to face with him. They say because he is very nervous.
Yeah.
Mainly the patient thinking, I am very stressful, I have a stress. No, this is not stress. This is because you didn't sleep well.
Sleep properly.
In the sleep proper, we have also some sections. First of all, when you go to bed, the first phase is you begin to sleep. You close your eyes and
You try to sleep.
yes,
Yeah.
you try to sleep. You know everything. You sleep. You hear some noises. It's phase one.
Yeah.
The second phase, you begin to sleep. You begin. For example, we know that the second phase is you are also watching movie and you close your eyes. Your friends say, "Please go to your bed." You wake up. No, I'm not sleeping. You also know,
Yeah.
but you sleep.
But you
You
sleep.
can also react. This
True.
is important.
True.
The third one is very important. We call it rapid eye movement. We call it you are like a dead.
Dead.
You are dead.
Yeah. The minute you
Deeply.
sleep, you are just gone.
You must sleep and you see dream in this section.
Yeah.
You see.
Yeah.
Yes.
True.
If you attempt this step, it takes, for example, in 1 hour, 15 minutes, 20 minutes.
Yeah, if you sleep for 15-20 minutes, you get dreams actually.
Yes.
When you sleep
Yes, sir.
suddenly, you see
You
dreams.
get deep also sleep. Then the mind begin to clearing. Yeah, the history begin to clean. Also, your heart will not so hard, work hard. For example, 20% it's slow
down.
yes, and your temperature will calm down.
Calm down.
Yes. Then you are really sleeping, and then, for example, 1 hour later you wake again, and then first pass, second pass, third. You must 3 times rapid eye movement attending. But if you have, for example, sleep apnea, what does sleep apnea means? You are sleeping, you are in a backward position, and your jaw come backward, and your jaw also block your airway.
It blocks your air.
Yes, it yours, and you also begin to
shiver.
Sleep. Yes, you begin to want to sleep awake, and then you are, for example, in the second phase, you return to one phase, and you never reach third phase.
Third phase, the deep sleep.
Deep sleep. And you're thinking I'm sleeping, but you're not sleeping. And therefore, you are always waking up very nervous, for example, these patients cannot focus anything.
Yeah.
When they read book, when they watch movie, they are begin to sleeping. When I'm working as a private clinic in my country, I look sometimes my waiting room, they are sleeping.
Really?
Their parents sleeping. I say, you didn't sleep very well. I say, you are snoring. They say, okay, how do you feel, how do you know this? This really, most of the people are coming from this problem.
And they don't know that this is the problem.
Yeah, this is
Sleep
the problem.
apnea is the problem. They don't know.
They know, but they say this is the reality. This because I was very tired. I was very stressful. No, you have to do anything well
To cure it.
Yes.
Yeah.
Otherwise, we know, for example, there has been also a journal published 2 years ago in the, I think, in Nature, most important published journal. Demence or Alzheimer caused mostly because of the apnea.
Sleep apnea.
Yeah, sleep apnea. Because they didn't also clear the cell.
The blockage.
Yes, the broken cell. The broken
yeah.
cell. They also stay because the broken cells always
repair when you're in deep sleep.
The REM sleep, the third phase. But when you don't reach, it also stay there. And what does Alzheimer mean? You also forget anything because you need clear cell, you need fresh cell.
True.
This is the
so
problem.
when you go in deep sleep, only then your body regenerates everything.
Yes, of course. You will be fresh. You will be also. You will be your next time. Your next day will be very nice.
Very nice.
Yes.
True. Once you get good sleep and you get up fresh, you can do 10 times better work than you are not sleeping properly. You're getting up and you're tired the whole day.
Yes.
I understand the way it works. Because even I have sleep disorders. But I thought it's because from childhood we are sleeping late.
Yes.
We were in joint family. We were sleeping late from childhood. I thought it's something, it's normal, common. But with time, I realized, okay, it's a problem and you need to get it cured. Sleep disorder is a problem, but sleep apnea is something very new to me also. But as you say, you need to get it done. Like you need to get the treatment done. Can you tell me how many patients have you dealt with approximately in a year, and what treatments they can take to cure this?
Yes. First of all, the patients also, we must also classify the patients. Some patients, for example, have only snoring, and it's very, very
Normal.
little portion.
Yeah.
For example, he or she gained kilos. In, for example, when you gain kilos in short time, you may have snoring. It's not problem, but it's a very, very small portion, I can say. The problem, mostly problem is when you are old, because when you are also the muscles tonus, muscles also strength will lose.
Lose, yeah.
It's we call it aging. It's normal.
Aging, yeah.
But with the accompanying to aging, when you gain too much kilos, plus when you use too much alcohol, for example, and when you also make a sedimentary life, we call it sedentary life. Sorry, sedentary life means you are always working in the office, going bed, watching TV, office, going bed, watching TV, no movement.
No movement.
We have to minimum 10,000 foot
Every
walking,
day.
sleeping. This is lifestyle.
Lifestyle. So basically, lifestyle impacts your sleep apnea
Of
a
course.
lot, a lot.
Certainly. For example, when we look for the persons, when they are also fit, when they are also making sports, we didn't see apnea diagnostic. But when we see, for example, people also not, they are not to face the sport, also they are
don't do
working,
exercise.
they do exercise with overweight, and this is the problem.
Yeah.
Now we have to change our lifestyle.
But as you see, the world is changing and we are all working on computers, phones, laptops. This is all life about right now. So people don't move a lot, and it's not like before, because now we all are running to, achieve something in life, get goals, get these things done. Even that does not let you sleep in the night properly. Like you're always stressed, you have to do this, you have to do that, you have to do this. We're just trying to get better every day. Now, in this process, we neglect our health and we neglect the sleeping pattern or lifestyle. So, is that also a major factor where sleep apnea occurs normally because of these factors?
Especially, I think the lifestyle is important. When for example, like country, for example, in Turkey, the also food is very important. And when you eat, for example, the food like late, for example, in European countries, they begin to sleep, for example, around 9 p.m. True. But in our country, maybe similar in Dubai, Oman, I don't know exactly, it's also from 11 p.m. or 12 p.m. Especially in the children, they have to sleep before 10 o'clock because they have growth hormone.
Okay.
And the growth hormone must be also product in the body around 2 o'clock, 2 a.m. If you sleep at 10 p.m., you can also get this growth hormone at 2 a.m.
Okay.
But if you go to sleep late,
at 11, 1.
Yes, 11, it will also, of course, the hormone will not so product. The second, we know that the children have this sleep apnea too. The children, for example, they are always having throat disease. They are always having, for example, problem from the nose.
True. Even kids now are snoring because previously we knew only old age people, 40, 50 above are snoring. But now I see even kids, when they're sleeping, they snore, and they snore like some adult.
I said, for example, we have also a lot of patients, they have adenoid. We call it adenoid because they are always working opening mouth. Because they cannot
breathe through
their nose. From the nose. And they are going under surgery, adenoid surgery called. And when they begin to breathing from the nose, they also grow. For example, there's another study published in the American journal. They say they look for the children unsuccessful in the class. They collect them and they also make treatment for the apnea. And most of them were successful.
Really?
Yes, because you can't focus anything. We must know that third one of our life must be spent by sleep. If you have lived 70 years, you must spend your life 19 years in your bed. You must do.
Really?
Yes,
That is the
this is,
calculation.
yeah, this is the calculation. Yes, this is the calculation. But the sleep must be have quality. This is important. When you go to bed, you can't sleep, or you thinking you are sleeping, or when you wake up, you are very tired, when you are nervous, when you make somebody nervous, sorry.
You get angry, actually,
Yes.
you get irritated, and
Yes.
you get frustrated.
That-
When you get up, you will start
Yes.
shouting at
For
people.
example, I always ask the question: when did you have a dream last time? These patients didn't have any dream. When I asked them, didn't dream, they can't remember.
They don't dream?
Yes, yeah, they didn't have dream because they didn't get
Reach the third layer of sleep.
Yes,
The deep
this is
sleep.
important part. When you didn't have any dream, then you didn't get reach the deep of the
Deep sleep. It's so exciting, because you've not reached that level and you don't get dream.
Yes.
Because normally we feel that it's okay, it's a day when we do not dream anything, but actually you do not sleep properly.
Yes.
True.
It depends on your life, of course. Sometimes most people, I think, the problem is they are also thinking we have stress. Stress is an important
Yeah,
factor.
because when we don't sleep or we don't get proper sleep, we get up tired. We think we are stressed, we are depressed,
Yes.
we are thinking about something, or even the outside factors. Like when we're sleeping, if there's too much cold, we don't sleep properly. If it's too much hot, we don't sleep properly.
Yes,
If there is
yes.
some noise, we don't sleep properly. So we blame all these things when it comes to
Yes.
sleeping. But we will never think it's something inside and it's something to do with your air pipes.
Yes.
So we never think
must
about
do it.
this.
Otherwise, the problem will also survive until our death.
Until your death,
Yes.
yeah, and you still don't know what happened to you.
Yes, unfortunately.
So, doctor, we want to know that what is the treatment for sleep apnea, and how can a person go to the clinic and get himself treated for the same issue?
I see. First of all, we mustn't be sleep apnea. This is important. When you be a sleep apnea patient, it's difficult. But sleep apnea means there's a problem with your airway. We must also, solution is simple. We must also prevent the blockage, preventing the air collapse.
Is there any treatment or there's some surgery or
Yes, there's a treatment, we call it CPAP or BPAP. Mainly, the pulmonary disease department sent the patients to the sleep laboratory. We call it polysomnography. And they stay there and also sleep there one night. During this night, they also diagnose EMG results, EKG results, all of them, and they look for the apnea scores.
It's like a test.
Yes,
they're doing a
yes,
test to know if they
There-
have
yes.
apnea.
There are two cables in your nose, in your mouth, and also for all night they also monitors you, and then they get the results.
So we have to sleep one full night there,
Yes.
and they will monitor you to see the problem.
Of course.
So, doctor, how do we monitor or how do we test that we have sleep apnea? What is the
Yes.
procedure?
Mainly it depends on the countries, but in Turkey, for example, pulmonary disease department mostly, or ENT we call, they refer the patients to the sleep laboratory. When you go to sleep laboratory, you stay there one night, and in
One full night you have to
yeah,
sleep
one
there.
full night you are sleeping
Okay.
there, and they also monitor you. You can also you have many cables on your body, EKG, EMG, for example, and we called it AHE scores, apnea hypopnea index. We called it. They look how many times do you have apnea, how many times you're snoring, how many times you have also collapse of the air, and then we have also report this. We report this, and then also the doctor give decision about this point. If you have over 25-30 times in a 1 hour apnea, you have collapse over 25 or 30 times, you have to use a device, CPAP we call it. CPAP is a device, it has also mask, it has also a plastic rule, and then device, and this device has a motor, and it also produces air.
So, do we have to take this one time or do we have to keep taking it? How is it?
All night. We have
Full
to
night?
Full night, and it's
Every day?
every night, yes.
Till you die?
Yes.
Really?
Yes. You have to do it because you can't also breathe. And it's also difficult, and it's also, you must take it. When you go to travel, journey, otherwise. And unfortunately, it has also just published in the journal, half of the patients didn't want to use it.
Yeah,
and they
because
reject to it.
it's such a big
Yes, yes.
it's such a big headache to carry that and take everywhere.
Yes,
And the
yes.
other thing is, even to maintain it when you're sleeping, maintaining a
Yes.
mask on your face is another different process to follow. It's very
I'm
difficult.
agreed. And the problem is mainly,
Hmm.
in my opinion, the airway has also blockage.
Hmm.
The air is also collapsed. But during this collapsed area, you want to pass air by using device. I think we must change this opinion. And in this point, I begin to research in my clinic when I was in another university, and I have been many times in United States because 30 million people are suffered from United States. 30 million people.
30 million
Yeah,
people
30 million are
are
suffered.
suffering from sleep apnea.
Yeah, are suffered from
Oof,
sleep
that's
apnea. Yes,
huge.
it's a huge shock. And they also have to use intraoral device. They also put their mouth and the device, but most of them was fabrication. I tried most of them, but they were successful because you put in hot water, you made it changing, and then put in a mount, and then you have position in your mouth position to get your lower jaw position, but it is unsuccessful. I tried it. Then I begin to my own working with my own patent products. It's also customized. You have to do individual for your patients. I take impression from the patients and then put their lower jaw in forward position because the the lower airway is in blockage because lower jaw is going backward and it causes to collapse.
Collapse,
When you
yeah.
put the mandible
In the
lower
front,
in
lower
the forward
yeah.
position, it's open. It's all very simple. It's very simple. You can make sense. And then I made it, and over 12 years, I used this product.
This technique.
Yes,
Okay.
this technique, and for 4 years, I have also my own patent and also CA quality product. I have got this, and in a year, in my private clinic, over 130 I used in my patients.
Yes, you use this technique on your
Yes,
patients.
yes, in my patients.
So there is no medicine or there's no tablets to cure sleep apnea.
Of course, 100%. It's also an instrument. You may see in basketball players in their mouth, for example, LeBron James maybe. It's similar like this. It's very easy to use it. It's also very comfortable to use it. And the main point, it also decrease
The stress
snoring.
to carry something
Yes,
and take
of
it
course,
everywhere.
of course.
It's totally like a relief, you can just
Yes.
use this device, put it in your mouth, and
Yes.
you can just clear your sleep apnea.
Yes, yes. It's
That's a good innovative way to get things done properly. Then you carrying something and taking wherever you're traveling, sleeping with a mask in the night. It's a headache.
yes, yes. It's no problem, and it's working.
Okay, doctor. Now we want you to give us a message for anyone out there in the audience who's suffering from sleep disorder. What message do you want to give
Yes.
them?
First of all, I said previously, you mustn't be a sleep apnea patient, but we call aging, anti-aging. A lot of people want to live forever, but
That's not possible.
yes, we know that's impossible. But we can live also. We have a quality of life. It's important. Therefore, we must. You can drink, you can eat. This is not important, but you must also live. You mustn't eat too much.
Yeah.
You mustn't drink too much. You mustn't. Our health is also when we are over 20, when we are over 30, 40. We must also take care.
Yeah, obviously.
This is also mentioned. Like I mentioned.
True. Your
yes.
body is like a machine, and it's
Yes.
like a house for your soul that
Of
God
course.
has gifted you. So you have
Yes.
to take care.
We have to do, for example, sport. I don't mean you must also playing football, playing basketball over 1 hour, 2 hours. But for example, every day we must walking. We must walking.
That's true.
Yes.
That's a very good message out there, guys, because as you see, our body is a temple, or our body is a house that God has gifted us for our soul to stay. So we have to take care of our health. Health is the first priority. Imagine I have neglected my health all my life, and now I realize, oh, what have I done from the childhood? It's very important to be healthy, because only you can help yourself when it comes to health. Nobody is going to lend good health to you. Not your mother, not your father, not your husband or wife or kids. Nobody can give you good health. It's only you yourself can give yourself good health. So whoever has sleep disorder problems, go get yourself checked. do the sleep apnea test and know what is the root cause of your sleep disorder and get it treated. Right, doctor?
Yes, it was
That's very
excellent,
important.
excellent, excellent. Yes.
Thank you, doctor. It was really nice. It was a very informative session because many people don't know about sleep apnea. I think after this session and this podcast, they might